I'm Jo Lloyd, I'm a psychology lecturer at Staffordshire University, and this is some research that I did with colleagues at Oxford University in the Department of Psychiatry, looking into the relationship between gambling and gambling problems and thoughts and acts of self-harm. And we were interested in looking at this because there's been quite a bit of research into the links between gambling problems and suicidality, but less has been done in terms of exploring the links with non-suicidal self-injury or self-harm. What we did was we collected data online from a large sample of online gamblers who also gambled offline, but we collected the data online with a survey methodology, and we got just over 4,000 responses to that. And we asked people to tell us about their gambling and their gambling habits, but also about various other psychological symptoms of various disorders, so whether they may have had mood problems related to alcohol and substance use and so on. And we also asked them to tell us whether they'd ever thought about or actually engaged in self-harm, either related to their gambling problems, if they had them, or for any other reasons. What we found was that there were certain factors that were associated with self-harm that was specifically related to gambling. So these were things like level of involvement in gambling, problem gambling symptoms, and also family history of problem gambling. Then there were other factors that were associated with self-harm that weren't related to gambling at all. So these were things like being younger and being unmarried, and alcohol-related problems. And then there were some factors that were particularly related to both gambling related and non-gambling related self-harm, and these were things like being unemployed, having symptoms of mood disorders, having problems with drug use, but also having maladaptive coping strategies, and specifically using gambling as a means of escape and a means of coping with negative emotions. It's got potential to kind of inform both assessments and interventions for people who may have either problems with their gambling or problems with self-harm independently, but also particularly people who may have difficulties with both of those areas, because it just helps give us a better understanding of the types of factors that are at play.